In this question, we have a 60-year-old man. He's been experiencing worsening fatigue, difficulty concentrating, forgetfulness, abdominal pain, constipation, and unintentional weight gain. He has a medical history of hypertension and ischemic cardiomyopathy and atrial fibrillation. Which of the following medications is most likely responsible for this patient's current symptoms? Now, the symptoms that this patient is experiencing is going to be classic for hypothyroidism. So the fatigue, difficulty concentrating, being forgetful, having constipation, and having unintentional weight gain is going to be classic for hypothyroidism. And out of the medications that are listed, amiodarone is going to be the one that is most likely going to affect the thyroid gland. And amiodarone can be given for rhythm control in atrial fibrillation, which is most likely the reason why this patient has received this drug. Now, a way that you can remember that amiodarone affects the thyroid gland is that it has this IOD in the name. And one important fact to know about amiodarone is that it has a high iodine content. So use the IOD in iodine to remember that amiodarone has a high iodine content. And this high iodine content can be important to know because if you have a high iodine content, then this can lead to the Wolff-Chagaff effect, which is basically this autoregulatory mechanism in which the thyroid gland can suppress production of thyroid hormones to make sure that we're not in a hypermetabolic state in the presence of high iodine. So basically, the enzyme thyroid peroxidase can be inhibited, and this is going to give us a decrease in the production of T4 and T3, which can lead to hypothyroidism. Now, amiodarone can also inhibit the peripheral conversion of T4 to T3, and T3 is going to be the active thyroid hormone, and this can also cause hypothyroidism. And one important thing to know about amiodarone is that it can not only cause hypothyroidism, but it can also lead to hyperthyroidism. Um, so there are two mechanisms in which that can happen. The first mechanism is that someone can have a thyroid nodule that they don't know about, and if you give them amiodarone, which has this high iodine content, then this thyroid nodule can use that iodine to produce thyroid hormones, and this can lead to hyperthyroidism. And also, not only that, but someone can be predisposed to Graves' disease. And remember that Graves' disease is going to be an autoimmune condition in which antibodies are going to be produced against the thyroid gland, and it's going to stimulate the thyroid gland to produce thyroid hormones, leading to hyperthyroidism. So someone can be predisposed to Graves' disease, and if they're given amiodarone, then this can trigger their Graves. So that's going to be one of the mechanisms in which it can lead to hyperthyroidism. Another mechanism in which amiodarone can lead to hyperthyroidism is that it can directly damage the thyroid follicles. And when we damage the thyroid follicles, because it has thyroid hormones inside, the follicles can release the thyroid hormones into the bloodstream, and that can also lead to hyperthyroidism. So one of the important things to know about amiodarone is that it can cause dysfunction in the thyroid gland, leading to either hypothyroidism or hyperthyroidism as a side effect.